Hello students, I am Dr. Rameshwar, orthopedics and joint replacement surgeon. I am proud father of two children and husband of lovely women. Today in this class, I am going to explain you about fracture, what is fracture, how you will diagnose it, what is the sign and symptom of the fracture, and what is the approach to treat it or what is the approach to manage it. First, start with the definition of the fracture. What is fracture? Fracture is breach in the continuity of bone. If there is any bone is there, this is a bone, and if something happens in its continuity, breach is in the continuity of the bone, that is called fracture. Fracture can be classified in different way. It will be classified based upon whether it is complete or incomplete fracture. Fracture can be complete, in which both the cortex or both the ends of the bone has been broken, and it can be incomplete fracture also. Based upon this, whether it is complete or incomplete fracture, based upon the displacement, whether it is displaced or in this displaced fracture. If there may be fracture, but it is not displaced. In the other hand, in the displaced fracture, the displacement is more than 2 mm, then it's a displaced fracture. And in displaced fracture, one fracture can be widely displaced when both ends are wide apart. Wide apart means 1 cm, 2 cm apart to each other. That is displaced fracture. And third classification in which you can classify the fracture is based upon the pattern of the fractures. It is transverse fractures like this. It's like this. It's a transverse fracture. Other fracture is oblique fracture like this. Oblique fracture can also be a long oblique, in which it is like this. The fracture length of this fracture line is more than this double of this diameter of the fracture. Means this diameter is this, and this fracture is more than double fracture line. Then is long oblique fracture. It can be a spiral also. This fracture can be a spiral also if fracture line is in more than two planes. You can understand. It's more than the fracture based upon the pattern. The other fracture is so-called comminuted fracture, in which the fracture is in different parts. More than 2-3 fragments are there. Other fracture based upon the pattern is segmental fracture, in which one bone has been fractured to more than one places. Means the fracture fragment will be 1 fragment, 2 fragment, 3 fragment. Normally in fracture there is only 2 fragments. So this one part and this is the second part. But in segmental fracture, the fractures happens more than 2 places. 2 or more than 2 places. That is segmental fracture. So based upon the pattern of fracture, you can divide which type of fracture it is. Based upon the etiology of fracture, you can also divide the fracture, whether it is traumatic fracture due to the trauma, something happened due to the trauma, or other is pathological fracture, in which there is some pre-existing pathology is there inside the bone which predispose it for the fractures. Like if the patient is suffering from some malignancies or bone tumors, or having infections, osteomyelitis, or if a patient is having osteoporosis. Osteoporosis is also a part of, or a stress fracture is also a sort of, you can say, is a pathological fracture in which some pre-existing disease is there. Apart from this pathological fracture, other is traumatic fracture. In traumatic fracture, trauma is the cause, injury is the cause of fracture, while in pathological fracture, there is some pathology which is pre-existing in the bone which predisposed for the fracture, and in pathological fracture, trivial injuries, trivial trauma can cause fracture. So based upon this, based upon the different way you can classify the fracture. One other way to classify the fracture is open fracture or closed fracture. Open fracture means if bone fragment has pierced the skin and the bone is exposed outside the skin, that is open fracture. And in closed fracture, the skin covering the bony fragment is intact, that is closed fracture. So these are different ways to classify the fracture. The next thing that is very important, how you will diagnose the fracture. Diagnosis of the fracture is very obvious. Even a layman can say my bone has been fractured. You can diagnose the fracture just by history, and the patient will tell that the bone has broken, there is abnormal mobility, he is not able to use his limb or arm or whatever part that has been affected. There will be swelling, there will be pain, there will be deformity, there will be loss of functions. He is not able to do whatever work that bone has been assigned to do. So from history it is obvious that it's fracture, but many cases like the fracture of the carpal bone, metacarpal bone or small bone, even this symptom will not be there. So you will go for the examination. In clinical examination, there will be tenderness, there will be swelling, there will be loss of function, there will be loss of transmitted movement. If there is fracture of this forearm bone, and if I will bend it, so there will be this hand will not be bent. It will just bend from the fracture site. So loss of transmitted movement will be there, loss of function will be there on examinations. And the one very confirmatory test or that can diagnose almost every type of fracture is X-ray, plain X-ray, plain digital X-ray. You can take anteroposterior and lateral view, or sometimes oblique view. In 99% cases, this used to diagnose the fracture, that it's fracture. In rare cases, sometime in difficult situation like in carpal bones, or if tarsal bones, or in undisplaced fracture, you need to go for other higher investigation like CT scan or MRI. Especially in periarticular fracture, if the fracture is around the joint and you want to know the exact position of the fracture, its geometry to define the exact way how you will going to fix it or to treat it, you may need CT scan and MRI also to diagnose that, or to plan its treatment, you may need CT scan and MRI. What is the treatment for the fracture? The fracture is treated by just two things. You have to just immobilize that fragment, and first is you have to just reduce the fracture. If it has been displaced, you have to reduce it, reduction, and other is immobilization. Immobilization is you have to just first, if the fragment has been displaced, you have to put the fragment in place, and then you have to keep this position for the long duration. That is called immobilization. And these are the basic principle to treat the fracture. First is reduction, and second is immobilization till fracture united. There are many ways to do it. It can be done by conservative means, by plasters, by slings, and sometimes if the fracture has been displaced wild upon, you have to do operative treatment also. These operations or these reductions it can be closed also, and sometimes you need to open that fracture by surgical procedure to reduce that fracture fragment. You can fix it, or you can immobilize it by externally applying plaster or slings, or sometimes you have to fix it by plate and screws. That depend upon the fracture geometry, but this is all is the basic principle how fracture is being treated. So in this class, I just explained what is fracture and what are the definition of the fracture, how we will classify the fracture based upon this displacement, based upon this fracture geometry, based upon this etiology, it's traumatic or it's pathological, based upon whether it is compound or simple, whether it is injury or not. Based upon that, you can classify it in different way. And diagnosis is by clinical history, examinations, and the gold standard to diagnose any fracture is X-ray, but sometimes CT scan, MRI is also important. And how you will going to treat it? Treatment is, the basic principle is reduction and immobilization. And to achieve these two goals of reduction and immobilization, you can go either conservative way or operative way. Operative way by open or closed reduction of that fracture fragment and applying plate and screws. This is all. I think if you want to ask anything more, you can ask me. Okay.